I think that's going to be important. Before we go back to questions from our chat, there's a lot of good ones. One more. So we briefly talked about it, how to prepare to when we come back. So stay informed, right? Get like literally ready, stay healthy, stay in shape. Anything else?
Well, when you physically go back into the office, that's when those new screening procedures are going to start taking place, that asking when you're confirming and so forth. But then you're going to need to run a shock treatment, most likely on your water lines. You should run a spore test on your sterilizers, but also run a chemical integrator at the same time, the strips that you put in every load. Because if you use a mail out service for your spore test, you're not going to get the results right away. So run a spore test, send it out, or process it in the office, put an integrator strip in. So test all the sterilizers. This would be a good time to check your ultrasonic unit to make sure it's functioning properly with, let me make myself a note here, Tiger, and I'll send the test procedure. It's using aluminum foil.
Yep, Julie said
can't write and talk at the same time anymore. So yeah, I'll send you that so you can add that, push that through to everyone. This is a good time to make sure before you open back up to make sure you have all of the prevention and control supplies you need. Do we have disinfectant? Do we have masks? Do we have enough barriers? All those things, and make sure that you clean up this is a great time to get rid of clutter in the office, but especially clean up your sterilization area, because I have the feeling what's going to happen, very similar to back when we had the AIDS issue, is that patients actually want to see what your sterilization area looks like. They want to know what you're doing. And if that sterilization area isn't pristine and looking very aseptic, you don't want to show it. It will do far more damage. And you should also, thank you, Julie, you should also test your water lines. So when you come back, you shock, and then you test.
Yeah.
So that's something that you actually probably would want to do a day or two, probably 2 days before you open the practice again. Because if you do an in-office water test, that's going to take at least 2 days, possibly 3, depending on what you're using, to make sure that you're below that 500 CFUs before you start seeing patients again.
Mary, let's take a few more things there. Lisa asked, are there modifications to the HVAC system to create rooms with more rapid air turnover, improve air quality?
There may be, depending on the facility that you're in, or there are air cleaners that you may be able to put in the treatment rooms that have HEPA filters, and they, of course, then help with the air exchanges. So again, we may start getting some recommendations from the CDC and from OSHA about that. We just don't know.